Hi, I'm Mary Rockwood Lane, and I've been so excited to be able to host and interview some incredible nurses. The Telesummit is called Conscious Visionary Nurses on the Edge of Evolution. This Telesummit was co-sponsored by Watson Caring Science Institute. I'm on faculty with Watson Caring Science Institute, and I've been privileged to be able to travel with Dr. Jean Watson. And my vision for sharing this with you is interviewing some of the most innovative, progressive nurses in the world that I know, and I'm hoping to do this many more times. There are 26 nurses that I've been able to interview, and I want to tell you about it because it's been a wonderful experience. I have absolutely loved it. I started out with speaking to Dr. Jean Watson about her idea of the future. And Jean speaks to how do we throw out the road in front of us as we're moving into the future. She talks about consciousness and how we can become more conscious of what we're doing as nurses. And Dr. Watson's work is about teaching us a language, a way of being. Nursing being based on the caritas processes of practicing loving kindness, being present, using our way, tapping into our own spiritual life as a way it fulfills us as nurses, creating healing environments, and believing in miracles are just some of the things she talks about. One of the things we're at a turning point in nursing is how can we create the future? This year we're celebrating the decade, the 2020 decade of the nurse and midwife. There are almost 24 million nurses around the world. And this is a call to action, how we can reach out to each other and inspire each other so we can be the change makers. We can be the visionaries of what the future of healthcare can be. And it depends on how we evolve as a professional, what we see is important. Our profession is what we do, but it's based on the discipline of nursing. I also interviewed Barbara Dossi, who's an expert in Florence Nightingale. 200 years ago, Florence Nightingale wrote today what nursing is. She had a vision of the future of nursing, and it has become what she envisioned it to be. Now we're on a threshold of the next 200 years. We are going to define the future of healthcare. Right now, with healthcare changing, we have businesses, hospitals, institutions, insurance companies defining what healthcare is. I think it's so important that we as nurses become leaders based on the value of what we do, that we create the foundation based on what we need, what our people, the people that we're serving really truly need. Nursing has a covenant with humanity, which means we serve to meet the needs of the people with their health, not only health, but their times of illness. Another speaker I talked about said in the future of nursing is one of the most important things we have to do is we have to take care of ourselves. Leanne Tellman wrote The Chicken Soup for the Nurse's Soul, which is a bestseller. And she was a wonderful person to talk to because she talked about how self-care is critical. And that is one of the things we've never really talked about in nursing. One of the most important places to start is how we care for ourselves. Jean Watson's theory talks about the way we learn about caring is by caring for ourselves first. And through that experience, we become more fully who we are. But Leanne talks about basic things like how much sleep do you get? What is the food that you eat? How much exercise? And this needs to be a priority. So your health and your well-being is a priority. So we can be at the bedside and meet other people's needs after we meet our own. Another speaker that I really loved was Dr. Richard Riccardi, and he talked about how we can empower ourselves and create a collective. And don't let our challenges limit us, but challenge our limits and move into what is hard. Don't be afraid of the limitations. We need to go to the limitations. We need to challenge those limitations. And the other message he said that I thought was really wonderful was infuse joy in what we do. Nurses love nursing, but sometimes they don't like their jobs. How can we transform our experience in our jobs? How can we make our jobs our calling in life and put our best self there? One of the things I believe as nurses, we can activate the potential of who we are as a human being. We can discover within ourselves and outside ourselves what are the barriers that are holding us back, and what are the breakthroughs that we need to make to be able to activate our destiny, not only the destiny of nursing and healthcare, but what is your destiny as a human being? How can you be a self-actualized human being and be able to use our profession and our discipline as a way of being the best that you can be as a human being in your life? Another speaker talked about foresight leadership, which means project ourselves into the future and 10 years and look back. And what do we need to get there? Things are changing. We can see into the future. Dan Prashut was a nurse futurist, and I loved talking to him. He had some incredible ideas that were very inspiring. The great thing about nursing, everybody comes from many different perspectives and has many different themes that they think is important for us to carry into the future. I'm on faculty at the College of Nursing at the University of Florida, and I was so privileged to interview my dean, Anna McDaniel, and she was really inspired. She has been a great support in my career and a great dean at the College of Nursing, and she talked about how education is foundational. She also talked about we cannot get too comfortable. We have to get to a point where we're able to handle the changes and the shifts that are happening in healthcare, and we're not going to be too comfortable, and we shouldn't stay comfortable. We need to be able to walk into the challenges and deal with the shifts that are happening in our world. And there is so much happening during this time. Another very inspirational speaker was talked about as a nurse. What nursing is an experience of being yourself. And who do you bring to the bedside? You bring yourself. This is one of the things I teach at the College of Nursing. I teach a course called Creativity and Spirituality in Healthcare. And I invite students to be creative and how they can use the arts as a way of transforming themselves to tap into their own inner resources. What is so incredible, the greatest gift you bring to nursing is who you are as an authentic human being. No one can take your place. Your greatest gift is yourself. When we get occupied with tasks and things we need to do and procedures that are going on and medications and prepping our patients, one of the most beautiful things that you bring to the patient is you. Your voice, your connection, your energy. You are part of the environment. We become part of the healing environment. One of the other speakers, Barbara Sattler, who is a professor at the University of San Francisco, I loved what she had to say. She talked about nurses who are activists in protecting the environment, and that's something I just love. And that's part of who we are as nurses, to become social activists, to protect this environment, because the environment is so connected to our health as human beings. Clean water, clean air, clean food, organic food, what's on your food. One of the things that nurses are doing is teaching people about how important the environment is in being healthy. So it's a public health issue. It was an incredible experience talking to all these different nurses and all over the world. One of the things I absolutely loved, I talked to a research director in Minnesota, talked about her research. When she was doing her research, she was studying about women with their hot flashes. And one of the ways that she shared her data, her research data, was doing art installations. Commissioning artists in the community based on what was happening in the data to create art installations of what the experience of hot flashes were. Now, this is a phenomenal, innovative way in which we can communicate our research to the public in very creative and innovative ways. And then I talked to Lisa Goldberg, who was up in Canada, and she was doing a lot of research on diversity and on women who were gay, and she was researching their experience of motherhood. And she was dealing with all these different diverse groups of people. And one of the ways she shared her research from that community was through drama. She took the stories that she recorded and the research that she was doing. They made a play script that was based on real life experiences, and then they went out in the community and did theater. This was like phenomenal. This is like new ways of us sharing our research. There is like so many innovative possibilities for the future. Another person I talked to was Dan Weber, who talked at a conference I went to called Leadership by Design. And he talked about how nurse entrepreneurs are creating companies to transform healthcare. Someday, there will be nurse concierge who actually people can call on the phone, and there'll be different kinds of businesses that are nurse run. He was telling us about how nurses are working for Amazon, Google, all these different companies where they were helping these big companies create healthcare systems within their companies. For example, the nurse that worked on Amazon was creating a healthcare system where they would be able to do health assessments with their own employees and someday the public to be able to get the feedback they needed, give the patients they needed, being able to deliver the products, the information they needed the next day. So, I mean, the future is unimaginable. Who knows what the future is? But we're going to create it. And this Telesummit is a call to action, because I wanted to give voice to these nurses, but I really, truly want to give voice to you. We are the ones that we've been waiting for. We are the ones when we become empowered and we actualize our potential as nurses. When we create a collective and we are able to resource each other, we're able to be inspired by each other. When we're able to ignite ideas for each other and with each other, that's how we're going to create the future together. So I'd like to invite you to become part of this community that I'm just beginning. My website is called Healing with the Arts. I invite you to sign on. You'll have access to this Telesummit. And I also want to explore ways that we can create a community that becomes a global community of nurses, where we can, through the diverse voices of us, of our profession, through the diversity of who we are, of all the places we are all over the world, we can come together and connect with each other. I've had the privilege of the last 15 years traveling with Dr. Jean Watson all over the world and talking to thousands of nurses. Nursing is a calling. It's something we are called to. So I want to ask you, what called you to become a nurse? Why are you a nurse? How can we give the best of ourselves in what we do every day, whether it's just to one person at a time, or whether it's to a community, or whether it's to an organization we work with? How can we support each other to be the best we can be and create the future? And not give our power away to a system that tells us what we do. The truth is, we know what we do, and we know what we do matters. And we also know that without what we do, it would not be healing. That when we reach out and touch someone's hand who discovers they have a new diagnosis, and we're there for them and support them, or we touch a mother who is taking care of a child who's going through chemotherapy, or we're in the emergency room when someone just came in the emergency room and they hear our voice. This is one of the most important things that this world needs. And right now, nurses are at the forefront in healthcare. They did not run away from the crisis, the health crisis. They ran right to it. We are brave and we are strong and we are courageous. And I want to thank you for the contribution that you have done to make a difference in the work that you do. My commitment is, how can I bring the light of who we are to each other? We just have to reach out and be connected to each other. So this is a call to action. I invite you to sign up on my website, and I am committed to stay connected and create ways in which I can explore ways in which we can create a community. Because in this moment, we are connected. We belong to each other. As Levinas says, there's a unitary field of consciousness, and the highest expression of that consciousness is love. And love is the greatest force there is. And we love our work. We love being nurses. And we are so lucky that we're part of this sacred and noble profession. So thank you very much, and I invite you to become part of this community and part of the Telesummit as well. So thank you. To the conscious visionary nurses on the edge of evolution, I welcome you because that's who you are too. Thank you very much.